Hello, everyone. Thank you for joining and giving me this opportunity to present my research work at Walden University. I am Dr. Deudonne Amuam, PhD in Health Services, and 2022 PhD student batch of Walden University. The title of my research work was Neonatal Intensive Care Unit Services for Preterm Babies, Experiences of Aghem Women of Northwest Region, Cameroon. Next slide, please. The problem statement. Infant mortality has been attributed to a greater portion to preterm birth as a major cause of infant mortality. There are several studies, including those of Lavalle et al. 2019 and Petit et al. 2019, indicating that to curb this increased mortality amongst preterm babies and infants under the age of 5, understanding the experiences of mothers of preterm babies was an essential measure. However, this data, that's the experiences of women with the services being provided to their preterm babies in Cameroon and sub-Saharan Africa, is limited. Therefore, this study was set to address this limitation or scarcity in data concerning women's experience with healthcare services provided for their preterm babies in Cameroon. The purpose of the study was to understand Aghem women's experiences with healthcare services provided for their preterm babies, and to understand how these women perceive that their healthcare experience influence the health outcome of their babies. Regarding the significance of this study, these findings will potentially provide baseline information to healthcare providers and other stakeholders, healthcare stakeholders, to look for means to improve or to improve their strategies towards the improvement of women's healthcare experience and subsequently the health outcome of their preterm babies. The theory that was used for this study was the Swanson caring theory. Swanson developed this theory through a series of work with mothers of preterm babies, women who were experiencing miscarriages, and parents and healthcare workers experience in the neonatal intensive care unit. The aim of this caring theory was to improve or enhance the biopsychosocial and spiritual well-being of patients during healthcare delivery. Swanson developed 5 tenets that describe the caring process, which include knowing, being with, enabling, doing for, and maintaining belief amongst patients while in the hospital. Therefore, I use this theory to guide the process of data collection and analysis. Next slide, please. Regarding relevant scholarship, as I mentioned earlier, the preterm is one of the leading causes of mortality in children under the ages of 5. Several scholars have indicated that, including Hoek et al. 2019, that preterm birth is one of the top causes of mortality. And Wagura et al. 2018 also indicated that the burden of preterm birth is unevenly distributed over the globe, with a higher impact in South Asia and sub-Saharan Africa, including Cameroon. There's Abezi and Emilefi 2020 also highlighted that the understanding of mothers' healthcare experience was a major effort in reducing long-term hospitalization amongst preterm babies. Adu Bonsafa 2020 also indicated that due to the scarcity of high quality local evidence-based preterm care research deprived healthcare workers and healthcare providers and other stakeholders, deprived them of the tools to improve healthcare experience amongst patients and subsequently improve the health outcome of their preterm babies. Also, Nurse Clark et al. 2019 used the Swanson caring theory to enhance the well-being of bereaved mothers and to improve the relationship between nurses and the patient. Next slide, please. To conduct this study, two major research questions were developed. The first research question was, what are the experiences of Aghem women of Northwest Cameroon with healthcare services provided to their preterm babies? Research question 2, how do Aghem women perceive that their experiences with healthcare services provided to their preterm baby influence the health outcome of their preterm babies? The procedure to actually conduct this study, I started by obtaining RIB approval from Walden University and the ethics clearance from the University of Buea in Cameroon. I also obtained permission, written permission from churches and hospitals in Cameroon in order to post flyers concerning the study. I also use the social media like WhatsApp groups and Facebook to do a publicity of this study. I recruited participants using both the purposeful and snowballing sampling. And in-depth interviews were conducted with participants who fulfill all the eligibility criteria. Participants for this study were made up of Aghem women who had given birth to preterm babies and had experienced neonatal intensive care unit services within the last 1 year to the time of the study. And these participants were 10 of them. Data analysis. To analyze the data, since the interviews were recorded, I first started with a word verbatim transcription of the audio tapes, and I also translated interviews that were conducted in Pidgin English to English. And I repeatedly read through all the interviews to have a global sense of the respondents' answers or interviews. I later went on to highlight words or phrases that could illuminate meaning regarding the research phenomenon. I also grouped all these quotes into categories and themes, respecting their similarities. I used the in vivo prof software I imported this data into the in vivo software where I could generate tables and continue with the coding and thematic analysis. Next slide, please. The findings. The findings of this study were categorized or classified into under the two research questions. Under research question 1, which is what are the experiences of Aghem women of Northwest Cameroon with healthcare services provided to their preterm babies. 9 themes were generated from these research questions after the interview with the participant. These themes included theme 1, healthcare workers knew the women. So many of these women could testify or report that healthcare workers knew them. Healthcare workers called them by their names during their time in the hospital, and healthcare workers could explain to them what was going on with their preterm babies and could ask them questions to understand what they had prescribed for their babies. One healthcare worker actually indicated that there was one time when the doctor was on round and they asked her about her wound that was on her tummy, and she was putting on clothes, so she could tell that they actually knew her in person, and they were showing some concern because she was surprised to hear them ask about a wound that had happened during delivery. Theme 2, healthcare workers were being with and spending time with the women. Some participants indicated that healthcare workers, for example, a participant who unfortunately lost her babies, who were twins during the stay in the hospital, indicated that one nurse came to stay with her after she had gone off duty to console her for the loss of her baby. So they spent, and even the doctor, when the doctor is on rounds, after the round, the doctor will invite them to come and tell them if they have any difficulties in the hospital or if they have understood everything. So theme 2, that healthcare workers were being with and spending time with the women. Theme 3, many women were taught, empowered, and enabled by the healthcare workers. For example, participants indicated that they were taught how to feed the baby with their breast milk using the pipe, and it was their first experience. Others said they had never carried a baby that has such a low weight. And the nurses in the hospital taught them how to carry the baby, to feed the baby, and how to to give medication, prescribe medication to these babies. So it was actually also a learning process to them. So healthcare workers were, these women were enabled and empowered during their stay in the hospital. Theme 4, healthcare workers helped their mothers in doing what they could not do while they were at the hospital. For example, there's one lady that gave birth through cesarean operation, and she could not, there were only 2 of them with the husband. The husband had left the hospital to go look for medication in a pharmacy out of the hospital. And that woman needed to eat. The husband had not yet come back. The nurse offered to go buy her food out of the hospital. So this justified this theme that healthcare workers help the mothers in doing what they could not do while at the hospital. And they could go out of their routine duties to do this. Another nurse even came back while giving the food back to the preterm mother, the mother of the preterm baby, and she did not collect money, so she actually used her money to pay for lunch for this mother. Theme 5, help the women were able to maintain belief and be hopeful. And this was with the help of healthcare workers. Like one woman is reported that during the last day that her baby passed, the pediatrician came in and was telling them that the healing process includes belief in God. And that she, the pediatrician, was only doing what they have learned in medicine, that the majority or the rest of it is done by God, and was encouraging the women to have belief in God. Theme 6, healthcare workers were unprepared and slow to provide healthcare services. Women also reported that healthcare workers were sometimes very reluctant to provide services to their preterm babies. A woman reported that when she gave birth to a preterm baby, the baby was left unattended in the delivery room for a few hours, and the baby was not in the incubator. So when she overheard the nurses talking amongst them, saying that the baby cannot make it. So it was very disheartening to this woman, and she insisted that she called the mother, who came and intervened, and out of a few exchanges, the baby was kept in the incubator. Theme 7, the women were surprised and unhappy. There were times where women were arguing about the bills that they give them in the hospital. And after such an argument, the bill was actually reduced. There was a time where the bill was reduced to by 50%. So the women were surprised and unhappy, and they had in their mind that the healthcare workers were actually just inflating the bills without actually matching that with the services they provided. Theme 7, the women experienced confrontation with healthcare workers. So there were times where women actually went into argument and shouting in the hospital against the nurses. One woman indicated that there was a time she saw an ant crawling on her baby while the baby was in the incubator. And she remembered that they were advised not to put their hands into the incubator until they have gone through some measures like sterilizing their hands and putting on appropriate dressing. So she asked the nurse to take off the hand. The nurse told her the hand was harmless. She could not bear it. She went into tears and actually shouted. The nurse refused until she went out of the ward and went to the delivery room to ask for another nurse to come and take off the hand before she could rest her head. Theme 9. There were times the women became bitter and frustrated. And most of these times was when the mothers lost their preterm babies while in the hospital. A woman narrated that when she gave birth to twins, one died 4 hours after delivery, and the other one was still in the incubator. When she went to see the corpse of that one that passed, the nurses had just put the corpse in a trash bag. So she was very frustrated and bitter to see how they treated the corpse of the baby. And she wanted to take out the corpse. They insisted that she has to pay all the services that they had administered to that baby before death. So the corpse spent about the additional 6 hours, in total 10 hours before they could take, and it was not even kept in the mortuary. So these were frustrating moments that the women encountered. Under the research questions, how do Aghem women perceive that their experience with healthcare services provided to their preterm babies influence the health outcome of their babies? Two themes emerge. One, women experience with healthcare services influence preterm babies' health outcome. Some of the women narrated that they actually think that when they are treated well, their babies, there's a higher chance that their babies will get well in the hospital. And one actually said, because she has been in good terms with the nurses and the physicians, attending physicians, her baby has been improving. The weight of her baby has been improving since delivery, and she was about to be discharged. Theme 11, women experience with healthcare services did not influence the health outcome of their babies. So some women also narrated that they don't think how their treatment, how they interact with the nurses has something to do with the health outcome of their babies. And most of these women who said this were those who had that, who did not have a cordial relationship between, there was not a cordial relationship between them and the nurses. So they said what was important for their baby's survival was the availability of appropriate resources like the incubator, constant current or generator, because one woman said she attributed the death of her baby to the lack of a generator, because there was one time that there was power outage and that went for a certain period of time and the baby was not well attended to. Next slide, please. Interpretation of these findings. To interpret these findings, I will group that into 3 subtitles. That's financial experience. From the findings, it has been shown that women went into argument when they were presented with the bills for the services that they offered, the healthcare workers offered to their babies. So this showed that women had financial worries and financial difficulties due to their preterm birth. In this study was consistent with that of Kennedy et al. 2020 and Zanel et al. 2019, who said that preterm birth leads to financial difficulty amongst parents of preterm babies. Positive experience is another subtitle under this interpretation. According to, inconsistent with Linda et al., it was shown that the findings show that women who reported positive healthcare experience had a cordial encounter with the healthcare workers, and healthcare workers treated them with dignity and respect. And lastly, the emotional experience. Women became emotional, they became frustrated when they were treated with disrespect, or when they treated their preterm babies with disrespect, like the woman who had her baby, the corpse of her baby wrapped like any other trash. This is consistent with the study of McLemore et al. 2018, saying that women experience of disrespect and discrimination during the care of the preterm baby were possible causes of their frustration and bitterness. The limitations of this study included the inability to generalize the findings. Because this study was conducted using a purposeful and snowballing sample of 10 women, Aghem women, this study could not be generalized to a greater population. However, to mitigate this limitation, I included women of diverse age group from 18 to 45 years. And I included women from different sociocultural backgrounds and from different locations in Cameroon. And the women, some were having their experience in the clinic, some were in the regional hospitals, some were in the referral hospitals in Yaoundé. So this was just another measure to mitigate this limitation of generalization. Another limitation could have arose from the face-to-face interview, where interviewees or the participant tend to develop what we call social desirability, where they respond to questions with the notion to please the interviewer. So with the assumption that what the participant provided as answer was correct and appropriate, to mitigate that, to mitigate the limitation of face-to-face interview and social disability, on the outset of the interview, I explained to the women what the study was all about, and that the goal of the study is to improve women experience and subsequently improve the health outcome of their preterm babies. So with that, we needed accurate information in order to do this. Another limitation could have been the translation from a pidgin English to English. To mitigate this limitation, I did it myself. I am a native, born and schooled in Cameroon, and a speaker of pidgin English and speaker of English language. I've studied both in Cameroon and the United States of America. Another limitation could be that of researchers' bias, knowing that with qualitative data collection and analysis involve the researchers' judgment and biases or previous knowledge about the phenomenon or study. To mitigate this limitation, I employed bracketing, making sure that all what I knew about Cameroon and preterm and experience of women did not influence the data collection and the analysis. I also involve my research committee in every step of the process. A recombination. To investigate mothers' experience with their preterm babies' health care services from the perspective of both the mothers and the healthcare workers. The scope of this study was limited to the experiences of mothers of Aghem women with healthcare services provided to their preterm babies. To have a more comprehensive knowledge about this phenomenon, I recommend further studies to carry out this same topic from the perspective of the mothers and the healthcare workers. Social implication, social change implication. The findings of this study may inform healthcare providers and other healthcare stakeholders with strategies to improve women's experiences with healthcare services and subsequently improve the health outcome of their preterm babies. And this study was as recommended by one of the researchers that there was lack of local evidence-based research. So the findings of these studies that were locally based, that were developed from locally based research amongst Aghem women could possibly stimulate healthcare workers in Cameroon to focus on improving women's experience with healthcare services provided for their preterm babies and subsequently improve the healthcare or the health outcome of their preterm babies. And improving the health outcome of preterm babies will lead to improving the health of the community and the health of the population of Cameroon and the world at large. Next slide, please. I've come to the end of my presentation. The full copy of this study is available and is published in Progress in the Walden University Library with more references for details. Thank you for listening.
Wonderful. Thank you. So it's already appeared in ProQuest. So awesome. I can dig up that link for anybody that needs it. What questions do you have for Dr. Amuam? You have some very nice comments in the chat, Dr. Amuam, if you'd like to see them before we finish up here. Yes, and there's thank yous in the chat as well. So thank you, Dr. Amuam. That was really great. And congratulations on finishing. That really must have been some hard interviews to give, yes? And then to go over them again, to translate them, probably dwells up all kinds of feelings as well. So congratulations on all that hard work. And anybody else have questions for Dr. Amuam? All right. Well, thank you for sharing that with us. We obviously can see your element of social change and you're doing good in the world. And thank you for sharing that with us today.